concept known as cultural competence. And what I really want to go deep into is really just the role of this concept in the healthcare field and the healthcare system. Cultural competence in healthcare means delivering effective, quality care to patients who have diverse beliefs, attitudes, values, and behaviors, and really making sure that you're connecting with your patients in a way that best suits them and helps them. How do doctors really balance Western treatments with respecting different cultural practices and values that can come out of the way medicine is done in different areas? So ultimately, really being able to have a healthcare system that's more culturally competent. Hey, my name is Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a Black male pursuing medicine. And in this episode, I want to get into something that I think is definitely central to some of the main themes of this podcast, and something that I think would just really help anyone listening to this episode. It's definitely a topic that I want to continue to go deep into, and I think it's something that I've referenced in quite a number of ways throughout this podcast. And so in this episode, I want to talk about a concept and a value that I think is really, really central to physician-patient relationships, to physicians really being able to care for their patients in the most effective and caring way possible. And so this is a topic that I think is definitely important to continue to have on this podcast. And so for this episode, I'm going to talk about a concept known as cultural competence. And what I really want to go deep into is really just the role of this concept in the healthcare field and the healthcare system. So we're going to answer a couple of questions in this episode. For instance, what's the significance of cultural competence in healthcare? Just what is the importance of it? As I go deeper into just what the meaning of cultural competence is, I want to really answer the question of how do doctors balance treatments with respecting cultural values and practices, and what are really the benefits of doing so? So with that being said, let's get into it. As we get into this topic of cultural competence, I first want to be able to effectively define what exactly is cultural competence. And for that, I want to get into a specific article that I thought was really, really helpful. And so this is a blog that was published on Tulane University's website, and they talk about how to improve cultural competence in healthcare. And in this article, they really well define just what cultural competence is, and I would say some of the important factors that should be kept in mind when talking about it. So their definition of cultural competence is that cultural competence in healthcare means delivering effective, quality care to patients who have diverse beliefs, attitudes, values, and behaviors. So it's really being able to connect a physician's expertise and their ability to care for patients to really understanding patients of different backgrounds when it really comes to culture and language and different factors such as those. And there's a couple of things that they bring up in this article that I also want to definitely highlight. For instance, they really talk about the importance of communication. And so in terms of that, they really go into detail when it comes to just how important communication is on physician-patient relationships. And that's really the fact that physicians and patients really want to be able to work together to be able to come to the best outcomes possible. And so they really talk about how cultivating skills, as they word it, cultivating skills that improve cross-cultural communication can play an important role in delivering equitable care. And they even also mentioned that building teams of healthcare professionals that reflect the diversity of the patient population served can improve cross-cultural communication. So that's definitely one of the benefits of having a more diverse healthcare system, which is something I want to get into in more episodes, and I've covered a little bit in previous episodes as well. And the other value that they brought up that I thought was very interesting and definitely needs to be talked about is also the importance of combining cultural competence with cultural humility. And so when they talk about humility, they're talking about ultimately, as they word it, being able to recognize the limits of people's knowledge of others. And they also mentioned that it really involves this ongoing process of self-evaluation. It's really this process of healthcare professionals being aware of their own implicit biases when it comes to different patients, which is something that's been covered on the podcast, and really just being able to approach their patients with a level of openness and curiosity. So I would say it's definitely being able to be humble enough to recognize the difference between yourself and the values and the backgrounds of the patients you may be dealing with, and really making sure that you're connecting with your patients in a way that best suits them and helps them. And with all those things being said, as I've really gone into just how important I think cultural competence is, I think it's definitely important to address the question of really, okay, what is the value of cultural competence? What impact does it actually have when it comes to patient care? Does it really help the healthcare system and the care of patients? And so for this, I want to get into a study that I think would definitely help us understand just how cultural competence can play a role in healthcare. And so this study is titled The Impact of Patient-Centered Care on Health Outcomes in Adolescents Living with Diabetes. And I would definitely highlight the fact that cultural competence and being able to understand patients is definitely something that really contributes and connects directly into having patient-centered care. And they really use the model of diabetes to really highlight just how patient-centered care can have an impact when it comes to patients' quality of life and outcomes. So they mentioned that considering that there is increasing evidence from research studies that would suggest that patient-centered care has a relationship with good clinical outcomes, they really go into this study to get a better understanding of that. And so what really happens in the study, to put a short summary of what they talk about, is that, quoting them, patients were approached at their appointment at diabetes follow-up in the outpatient clinic. What also happened was then patients would complete these validated questionnaires that would have information on demographics, patient-centered care, and quality of life. And what they found in terms of results, as they mentioned, is that from a statistical point of view, the present study results showed that a statistically significant correlation exists between good patient-provider communication and patient quality of life. So that means that really having good communication between the physician and the patient ultimately contributes to a better quality of life for those patients based off of this study's results. So they also mentioned that emotional support from providers fostered by patient-centered care are likely to contribute to patients' emotional functioning. So that also shows that there's really an emotional benefit when it comes to that connection between physician and patient that can really come out of having that patient-centered care. And ultimately, this really just shows that patient-centered care can have a direct positive impact when it comes to physician-patient relationships and ultimately just improving the quality of life of those patients. And so I would say, considering that cultural competence is really something that's going to have to play a role in having the best patient-centered care possible, it would really just show that cultural competence is able to have a positive impact, considering the impact that patient-centered care is able to have on the lives of patients and ultimately improving their quality of life. Now, one of these smaller conversations that I also want to insert into this episode would really just be considering that cultural competence really focuses a lot on being able to connect to patients' different diverse beliefs and attitudes and values and things like this. I think it's definitely important to highlight just how differences in treatment can show up when it comes to care, specifically in the United States and when it comes to Western medicine. So this really just flows out of a conversation I remember I'd gone to hear during a class not too long ago. And it really just highlighted how there can really be some differences when it comes to Western medicine and when it comes to the style of medicine that you often find in other cultures. And so I think when you definitely consider caring for patients, especially in underserved and diverse communities where you're going to have patients of a lot of different ethnic and cultural backgrounds, you're going to want to consider that medicine isn't always done the same in every single country. And patients are going to expect different things out of their care and their treatment process, depending on the background that they're coming from as well. And so one thing that I want to really focus in on is how do doctors really balance Western treatments with respecting different cultural practices and values that can come out of the way medicine is done in different areas. And so ultimately what we really often find is that, number one, Western medicine is really some of the most advanced worldwide, and it's very much focused on treatment and evidence-based medicine. And certain cultural values can actually place weight on certain treatments, specifically when it comes in the form of a lot of remedies or maybe certain natural treatments. And so an example that I remember really coming up that I think I would really want to bring up in this episode would have to do with, for instance, a physician wanting a specific medication or a specific drug versus a patient maybe wanting to focus on a specific natural remedy that they're more used to. And so to really get an idea of this sort of tension that can show up here, I want to specifically go into an article that I thought really helps highlight some of the differences between Western and more Eastern medicine. And for this, I want to focus our attention towards an article that was published on Medical News Today's website. And they talk about Western versus Eastern medicine, what to know. So just to go through some information that they bring up. First, they really talk about Western medicine, and they mentioned that it really forms the basis of most modern healthcare systems in the world. It's very much focused on treating diseases with certain medical treatments and procedures, such as drugs, radiation, surgery. Whereas when it comes to Eastern medicine, it can be a little bit different. So when it comes to Eastern medicine, it often refers to medicine and treatments that are not part of standard medical care, and it's one of the oldest systems of medicine in the world and originates from Asia. Now, as I mentioned, people can refer to Eastern medicine often as complementary, alternative, or natural, and Eastern medicine will often accompany both traditional Chinese medicine and specific techniques that can often be very holistic. So some of these treatments that some of us may really be familiar with, for example, would be acupuncture, Chinese herbal medicine, certain nutrition, and even activities such as Tai Chi. Western medicine will often have some key foundations that really make up how the treatment works. For instance, it's very much focused, of course, on physically examining the body, looking at certain symptoms, being able to diagnose disease and conditions based off of those symptoms, and then ultimately really use treatments that are clinically proven to be effective. So there's definitely a very, very heavy focus on evidence-based medicine and a lot of times research. Eastern medicine will often look at really diagnosing disease by really focusing on the entire body. And one thing I definitely want to make sure I bring up as a highlight is that Eastern medicine really has a significant emphasis on prevention, whereas Western medicine might have a little bit of a preventive impact, but it'll generally focus on really using specific medications or treatments to really combat certain issues. And one thing that I thought was really important to bring up also is that I definitely think, just as I'm mentioning when it comes to Eastern medicine, how there can be this very preventative focused sort of care. I think it's definitely important to consider just sort of benefits that can come out of something like this, considering that Eastern medicine is often associated with more of alternative medicine. And this is something that some doctors will even very much focus on in the United States. And I think one thing that we do have to consider, I would say, is that there's definitely more of a lack of really strong preventative care as opposed to maybe more reactionary care, as ultimately preventative care is the thing that can really keep patients out of hospitals and emergency rooms and emergency sort of situations or exacerbations of certain chronic conditions. And so preventative care is definitely something that I think we want to focus a lot on as a country. And I think Eastern and alternative medicine just gives an example of one of the ways that these things can really improve. So ultimately, I would say when answering the question of really balancing Western medicine and practices with different cultural values and practices that can come out of other areas, I think it's really important to consider, number one, the situation, as different situations could call for different treatments. And I think ultimately you really want to go for the solution that's going to allow you to really connect to your patient and their values as best as possible. And so I would say definitely when it comes to maybe dealing with situations that can call for a lot of long-term or more preventative care, I think it would definitely make a lot of sense for physicians to be really trying to use natural remedies that their patient may really prefer in terms of how their care works in the long run. Now, with all of that being said, I think it's important to take a moment to really highlight and consider what are the benefits of really doing so when it comes to really focusing in on cultural competence in healthcare. And I know we've covered how it can connect a lot to patient-centered care and just how that can contribute to better quality of life for patients. As we've talked about the significance of cultural competence, the impact that it can have when it comes to patient care in terms of its connection to patient-centered care. Even as we've talked about how Western medicine can differ from the practices that are found in different cultures and how different patients' backgrounds may connect more to different types of medicine. I really want to focus in on, after talking about just the importance of cultural competence, what are really the ways for our healthcare system to maybe become more culturally competent and just physicians and people to be more culturally competent. And for this, I want to point our attention to an article that was published on Welkin's website. And they talk about 13 ways to improve patient care. And I want to go through a lot of the things that I found very helpful in this article. So for instance, they bring up some values that I think are very important to consider when it comes to, as I mentioned, showing respect. So I would just say that really comes down to being able to be respectful and humble when it comes to different patients' backgrounds and some of the differences that they may have in terms of how they view healthcare compared to how some of us may view healthcare. I think especially when it comes to physicians, being able to care for patients in a way that's very, very focused on being able to understand our patients' backgrounds and some of the values and the concerns that they may have in order to really help increase their self-efficacy and allow them to really be part of that partnership in terms of patient care. Another value they bring up is expressing gratitude. To look at some other values they bring up, they mention enabling access to care, which I think is very, very crucial. And they even bring up the fact that social determinants of health will often play into this. So ultimately, really able to have a healthcare system that's more culturally competent, you have to have a healthcare system that's willing to really care for a lot of these diverse and underserved communities and populations that are going to potentially have different experiences when it comes to healthcare and ultimately different values and goals. Another thing they bring up is involving patients' family members and friends, which I think is also an important thing where in terms of really where applicable, being able to have as many people that are close to that patient be involved in their care and really just, again, center around the things that are very crucial to that patient's values. They mentioned providing emotional support, which is what I would say cultural competence can connect directly to, just in terms of being aware, again, of that patient's values and their attitudes and being able to really just connect with them in a way that supports them best. They mentioned supporting patients' mental health and also helping your patients manage their medications, which I think all, again, just really connect to just that self-efficacy that you want patients to be able to have in terms of really being a part of their own care. They mentioned practicing whole person care, which I think really goes into just that holistic care of a patient's not only physical needs, but also, as they mentioned, mental factors, emotional factors, and really just anything that plays a role when it comes to holistic care. And the last thing they bring up that I thought was really interesting was the fact that they bring up streamlining care management with technology. And so this is something that's been covered on the podcast to an extent and that I want to also cover on the podcast even more. That really just comes down to how technology can potentially play a role in improving patient care and improving patient outcomes and ultimately being able to specifically care for different patients and personalize their care. And so with all these things that we've covered, I really want to focus in on just the importance of really being culturally competent of patients. I think one thing that I want to continue to really emphasize on this podcast is really the fact that there's just so many factors that play into healthcare. Really, when it comes to social determinants of health, there's definitely a lot of things that we have to have in mind when it comes to patients coming from underserved communities that can often have predominantly minorities in those communities and people that are going to have different backgrounds and different experiences when it comes to healthcare. And I think as a healthcare system, we ultimately want to make sure that we're able to serve those patients in the best way possible when it comes to the way we approach healthcare, when it comes to really having a diverse healthcare system, and really just being able to have that focus on, again, just as we mentioned with cultural competence and ultimately just having that patient-centered care. Because I think, again, healthcare and caring for patients isn't just treating a bunch of physical illnesses, although that's a key part of it, but it's ultimately being able to care for patients and care for people holistically. And so I think we always have to have in mind the things that are going to shape different people's experiences. And so with all those things being said, that wraps up this episode. I hope you enjoyed it, and let's see what we talk about in the next one.